October 13th is the World Thrombosis Day. Serena Williams once said, "I was literally on my deathbed." She shared about her experience with pulmonary embolism. That one quote puts into words just how life-threatening blood clots can be. I'm Dr. Anuj Shah at Apex Heart Vascular. On this World Thrombosis Day, I want to talk about something that often hides in silence: blood clots. They can affect any one of us. Blood clots or thrombosis happen in two types. Arterial clots, which are in the arteries, cause heart attack and strokes, and venous clots in vein causes DVT or deep vein thrombosis and PE or pulmonary embolism. They kill, they disable, they disrupt lives. Here's what the data show. Thrombotic conditions underlie about 1 in 4 deaths worldwide. Yes, that's 25% of deaths every year. In the US, up to 900,000 people develop DVT or PE every year, and around 60,000 to 100,000 die from them annually. More than half of VTEs occur during or soon after hospital stays. That means clots are a leading preventable cause of death in medical care. Left untreated, about 1 in 10 DVT cases evolve into a potentially fatal pulmonary embolism. These aren't abstract numbers, they represent real lives lost or permanently transformed. Despite its huge impact, thrombosis doesn't always make headlines unless it strikes a famous name. Consider President Donald Trump, who was recently diagnosed with chronic venous insufficiency or CVI, which is a vein disease that causes poor blood flow, often seen as leg swelling or varicose vein, and is very common, affecting about 1 in 3 adults in the US. Importantly, having CVI raises one's risk of developing a deep vein thrombosis. In Trump's case, the diagnosis brought attention to a condition that many people have without realizing the link to clots. These are the stories that bring it home. Serena Williams had a history of clots. After the birth of her daughter, she developed shortness of breath and insisted on evaluation, and a CAT scan revealed multiple pulmonary emboli or clots in her lungs. Thanks to prompt treatment, she survived. Chris Bosh, the NBA All-Star, suffered repeated blood clots. After a PE, he returned to play, but subsequent leg DVTs forced him to a medical lockdown. In 2016, he failed a physical and his career ended due to clots. Victor Wembanyama had a DVT in his right shoulder, a rare location. Despite being in peak condition, he was taken off the court while treated with blood thinners. Damian Lillard was diagnosed with a DVT in his calf during the season. The team treated him immediately, and he's been on anticoagulation. Gal Gadot, Superwoman, the actress, revealed having a massive blood clot in her brain during her pregnancy. These stories gained a lot of attention in the media, but they should serve as a wake-up call for all of us to stay vigilant. What will the research tell us? We have come a long way in understanding how to treat clots. We now have solid trial-backed tools. Anticoagulation therapy in the Einstein DVT trial proved that a single oral drug like rivaroxaban is as effective as the old regimen, which was low molecular weight heparin with warfarin with comparable ingredients, which means fewer injections, fewer lab checks, and more convenience for the patient. What about removing the clots or thrombectomy? In the ATTRACT trial, which evaluated patients with DVT, it showed that catheter-directed thrombolysis, adding clot-busting drugs by a catheter into top of systemic anticoagulation to prevent long-term damage or post-thrombotic syndrome. There was no significant findings seen in most of the patients except for those who had iliofemoral DVT, and now we reserve this technique for severe cases with limb-threatening clots or those who have iliac vein clots or femoral vein clots, but treat rest of the patients with conservative therapy. In the world of pulmonary embolism, there is a lot of new trials, especially the PEERLESS trial, compared two advanced treatments, mechanical thrombectomy versus catheter-directed thrombolysis in immediate risk patients, and results favor thrombectomy on composite outcomes like fewer clinical deterioration, reduced ICU stay without extra bleeding or mortality. In stroke, trials like MR Clean, ESCAPE, Extended IA, and others have shown that removing clot from the brain arteries in acute stroke dramatically improve outcomes. In many hospitals globally, thrombectomy is now the standard of care for eligible stroke patients, eligible pulmonary embolism, and DVT patients. Because of these trials, now we tailor therapy. Anticoagulation for most clots or many clots, but aggressive procedures when the clot is large, obstructing flow, or affecting vital organs. What do we do at Apex Heart Vascular? We bring all the tools to the back. anticoagulation strategy with direct anticoagulants or novel anticoagulants, along with low molecular weight heparin and other medications as a first-line therapy, using catheter-based thrombolysis in selective high-risk cases, mechanical thrombectomy to devices to remove clots, especially when rapid restoration is crucial. IVC filters when anticoagulation is not an option for recurrent DVT. Participate and take part in thrombosis response pathways like PERT teams, ensure patients get fast diagnosis and treatment. We take care of the sequelae. The consequence and prognosis of this DVT down the road can be very debilitating and even deadly, and causes a lot of symptoms including vein ulcers, thrombophlebitis, and lipodermatosclerosis, and severe post-thrombotic syndrome or PTS. And we can take care of them if, unfortunately, patients develop them. We can take care of them with vein ablation and sclerotherapy. We also play a role in prevention protocol for hospital admission by doing risk assessment, compression therapy, and early mobilization. We believe in attacking clots quickly, intelligently, and safely. So what can you do today? Let's take steps to stay away from clots. Know the signs: leg swelling or pain, sudden shortness of breath, chest pain. Act fast. Reduce risk factors. Move more, hydrate, avoid long-term immobility, review medication that risk clot risk. Ask about clot prevention in the care. When you are hospitalized, ask, what am I doing to avoid clots? Push your hospital or clinic to have a thrombosis response system. Speed matters with clots. Share awareness. Talk about these stories, Serena, Bosch, Wembayama, to break the silence, because knowledge is power. Let this October 13 be more than a date. Let it be a moment when we recommit to prevention, early detection, smarter treatment, to saving lives and protecting limbs. Prevent blood clots and save lives. Thank you so much.